Okay, so for the next part of the video, we're going to be examining the knee and the feet. So the first thing I'm looking at the knees, I'm looking for any hollows in the knees. So the 2 hollows on each knee, looking to make sure those are there. If they're not there, that could indicate some swelling. Then I am going to be looking for the patellar tendon here, as well as the tibial tuberosity at the top here. I'm going to be feeling for the MCL here, feeling if there's, or having him tell me if there's any pain, and then the LCL, so the medial and lateral collateral ligaments. I'm going to be checking the patella. I'm going to be moving it side to side, up and down, side to side, up and down for any pain. Then I'm going to be going down the lateral tibia area to assess for shin splints. Great. And then when I get to the feet, let me just get the feet in frame here. So when I get to the feet, the first thing I'm going to be palpating is the anterior ankle joint on both sides, the medial malleolus. I'm trying not to get in front of the camera. So the medial and the lateral malleolus. I'm also going to be assessing for the Achilles tendon down here to see if there's any pain. And just pressing on the top of the foot to see if there's any pain there. And I'm going to go down to the head of the metatarsals, feeling there. Just feeling the toes. Just feeling the joints of the toes. And then I am going to test for any plantar fasciitis by pushing here in this area of the foot. Okay, and then I also want to, this area where they generally have bunions, I'd be pressing there as well. Focusing on the 5th toe, the 5th metatarsal, to if they had any ankle injury. So the next part that we're going to be doing is the range of motion. So we're going to do some dorsal flexion, which is pulling your toes up to your face. Great. And then we're going to do plantar flexion, which is down as far as you could go. Good. And then we're going to do some, I'm going to have you bring your feet together and have you point your toes out laterally. And that is going to be eversion. And then the other way is going to be inversion. No, I think this is actually eversion and this is inversion. We kind of went over that in class a few times. Yeah, so that's inversion. So it's the heel, what's pointing in. So inversion, and then again, eversion. Good. And then we're going to do strength. So again, dorsal flexion for strength. Good. Plantar flexion, so you're pushing against my hands. Good. And then I'm going to do each, the medial, press against me, and then push out. Good. Okay. So for the next part, when I go to do the spine, I'm going to move the video around so that we can get that in full view.